Our skin is a precious thing, and as technology evolves, so does the treatment of skin damage. And with me this morning, our friend Dr. Joel Cohen, Director of About Skin Dermatology in Greenwood Village in Lone Tree. Now, Dr. Cohen lectures internationally. He's written over 230 scientific articles as well as 3 academic textbooks. He knows what he's talking about. And he's going to give us an update on what's new in the world of cosmetic laser procedures. So you recently lectured at a session, and was a session director at the International Laser meeting here in Denver a few weeks ago. How was that?
So the American Society of Lasers and Medicine and Surgery was here in Denver a couple weeks ago. It was all the innovations from around the world in terms of new technology and new ways that we can use things in combination.
Okay, and we're going to look at some pictures now, in fact. This one is a patient who has some redness on the cheeks. So discuss some treatment for this.
So people who have rosacea type 1 just means that they have some redness and some vessels that are prominent in the cheek. This becomes more prominent when they flush, and we have technology to make this better. And if we use a combination of a couple different lasers at the same time, we can make it better more quickly.
Okay, we got another photo. How do you approach pigment and sun damage with lasers?
So first, we encourage people to get their skin evaluated to make sure this is benign pigment. As we look at these spots, they're uniform in color. They have no evidence of any irregular borders or irregular color variation within it. So we can use, similarly, a combination of a few different lasers to actually make this better with very minimal downtime, just a day or two of some redness and a little coffee ground appearance.
And then, of course, lines and wrinkles, they're probably hard to approach.
Lines and wrinkles are much more challenging to approach, and we use several different lasers in the same session to see improvement in all these different parameters. These etched lines need to be resurfaced with what's called an ablative laser, so this has downtime. It does take several days or even up to a week to see really resolution of the healing response.
Okay, we've got about a minute left. Talk about your algorithm for all these types of results.
You know, we really encourage people to be diligent about using sunscreen, making sure that they wear a hat and protect themselves. There are skincare products that can be really helpful, and then there are ways that we can use these lasers in combination to really give people great results, whether it's pigment, redness, or lines and wrinkles and laxity.
And this is something you recently published, what we were looking up on the screen there. So finally, the final case of pigment patches on the forehead.
So melasma is a really difficult condition to treat. It actually is caused by hormones that make women more susceptible to even small amounts of sunlight getting pigment. So by combining topicals at the same time as laser, and this was a big emphasis at the meeting, we can do what's called laser-assisted drug delivery. We can enhance the penetration of these topicals.
So interesting, pretty fascinating, and of course always wear that sunscreen.
Yes.
We talk about that, and it's that time of year too. So bring that sunscreen out. Dr. Cohen's website, aboutSkinDerm.com. Thanks for joining us.
Thanks.
You have a happy Easter.